Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the drowning. So by drowning, we are looking at the antemortem versus the postmortem drowning. So let's start with the antemortem drowning. So antemortem drowning, the froth and the foam from the nostrils or the mouth. We would have seen the images. This is nothing but the antemortem drowning. So the froth is seen in case of the antemortem drowning. So whatever we'll be discussing is only going to be about the antemortem drowning. So what about the cadaveric spasm? The cadaveric spasm is also present in case of the antemortem drowning, and the postmortem drowning is totally absent. Then when you look at the lungs, so let's talk about the lungs. So here in the lungs, there's emphysema aquosum, there's edema aquosum, as well as the edema aquosum is seen in case of the unconscious individuals, and the lungs are voluminous, bulky, and waterlogged, and as well as it is overinflated. So in case of antemortem, they are bulky. The lungs, they are bulky. The lungs, they are bulky, they are waterlogged as well as overinflated. Whereas in case of postmortem, they are passive collection of the water in the lungs. So postmortem, it is passive collection of the water in the lungs. Next, we move on to the presence of the foreign bodies. So here are the foreign bodies, we mean the weeds, debris, or the vegetation. So it is present in case of the bronchi and the bronchioles. This is with respect to the antemortem drowning. So it is present in the bronchioles as well as the bronchi. This is only with respect to the antemortem. In case of the postmortem, it is passively collected only in the upper respiratory passages. So in case of the postmortem, the drowning. So postmortem drowning, it is passively collected in the upper respiratory passages, URP. Then when you look at the diatoms, so diatoms are present in the lungs, the liver, the brain, and the bone marrow. This is in case of the antemortem drowning. Whereas one significant finding is in case of postmortem, it is present only in case of the lungs. So postmortem drowning, the demonstration of the diatoms. So if you look at diatoms, it is present only in case of the lungs. Whereas in case of antemortem, it can be present in the lungs, it can be present in the liver, brain, bone, marrow. Then we look at the stomach contents. The stomach contents, in case of antemortem drowning, it is basically water and the foreign material like the sand, wheat, dirt. This is in case of the antemortem. In case of postmortem, the water is less in quantity, is of lesser quantity. So in case of postmortem, water is going to be less. To learn and grow daily like this, please do subscribe.